So maybe I'll start with Sattva, Ronika.
Yeah.
So Sattva is, a consulting firm focused exclusively on social impact. We work primarily across four areas. One is where we work with, the entire funder community in really strategizing and helping them design their impact approach and their portfolios, and two, helping them manage their investments to ensure that they get the best social return, right? So that's one part of our work. The second part is where we work with non-profits and social enterprises, so social purpose organizations overall, in helping them achieve their social impact goals, right? So again, working around helping them build organizational capability, defining strategy with social enterprises, particularly looking at go-to-market kind of support and so on. The third part is really, I would say, collaborative initiatives, right, where in partnership with government, non-profits, funders, private sector players, really looking at designing solutions and helping implement impact at scale.
Right.
Right. So that's again something that we focus on, and a lot of this is also backed by data and research, which helps kind of further the cause. And the fourth part is, again, we have technology products that power some of our own work. So whether it's an open source data good platform called India Data Insights, whether it's a platform that helps our clients manage their grant portfolio effectively as well, right? So this is, I would say, the broad buckets of what Sattva does. We have focused very specifically on certain sectors in the last 2 years, Ronika. And while I would say we've been typically sector agnostic over the last many years, the last 2 years, what we realized is that we've built a lot of depth and understanding across different sectors. But we also wanted to take a little bit more of a step back, look at proactively what are some of the key challenges that the sector itself faces, and bring in that input to also influence various actors in the sector towards moving to solutions that we believe are relevant and important. Right? So we have about 6 practice areas, and health is again a core area for us in terms of what we are doing. Now, from a health perspective, again, our work is diverse. So from the nature of projects that we deliver range from, I would say, really strengthening public health systems. So working with state governments, with non-profits on designing multi-stakeholder engagements to say how systems can be strengthened to deliver public health care effectively. Right? To actually supporting social enterprises in, contextualizing solutions for BOP markets or, public rural markets, so to speak, and helping them again take that and implement that towards scale up in partnership with several players. Right? 3 is helping non-profits understand the space better, and that could be in the form of research, for example, landscape assessments that would help not just non-profits but even funders both design solutions as well as look at what types of investments they need to make depending on where the sector is headed and where are the white spaces, right? And we, in addition to, I would say, the public health sector, which is a large part of our focus, it's also about impacting private sector. Right. So we do have initiatives that focus on strengthening the private sector care today as well, given that it really forms actually a large chunk of healthcare delivery in India. Right. So I would say from a functional area of focus, these are the broad themes. From a thematic area, again, our work spans across multiple initiatives. So RM and CHA is a very, very important area for us in terms of the work that we've done across, I would say, ranging from policy level support to supporting with research and evidence to implementing programs across on the ground.
Yeah.
And again, ranging from issues such as nutrition, SRHR, right?
Yeah.
And even some work around the intersectionality, for example, between TB and nutrition and so on, right? So really looking at, I would say, various thematic areas. So RMNCH is one. Communicable disease, again, is another area. But broadly, we've done a significant amount of work during the COVID piece, during COVID, especially in terms of working with ACT grants, helping design, let's say, what should be the response, how do we look at, again, supporting initiatives and solutions that are sustainable, that are multi-disease focused, that can really integrate, strengthen systems and last for the longer period while keeping in mind the immediate need, right? And even we've also worked with IHF, for example, on a couple of areas, as you're already aware. And even on the NCD side, one key area that we've we worked across multiple areas, but we've also looked at mental health as a critical focus, and looking at designing solutions there again, which can be integrated and scaled up within existing systems, right? So, in addition to, so these are, I would say, the themes and the functional areas with which we work in Ronika. But in addition to this, I think, or rather within this ambit, one of the key things for us is also influencing ecosystem, right? So we do, look at creating knowledge, whether it could be, let's say, in the form of, assessments of reports that come out. So, for example, the NFHS survey and, the NHM initiatives and so on, which are already there, but really making it consumable, actionable, talking about what, let's say, are some of the opportunities that you can use from, existing programs, and for each of the actors, right? Whether you're a non-profit, whether you're a funder, whether you're an innovator, what is it that you can do? We also run a lot of ecosystem level convenings, which are closed door in nature, but really look at bringing together diverse viewpoints and diverse actors that are engaging on a problem, but from different lenses, right? And trying to come together to talk about what are some of the challenges, what are some of the solutions, really what are, let's say, actionable ways for even philanthropy to engage in this space, for example, right? So convenings, again, is a critical, I would say, focus area in terms of what we do. And I think overall, our focus is system strengthening, right? So whatever it is that, whether it's thematic, functional, or if it's a pilot that we're doing, or if it's a convening that we're doing, how does the output of that go towards strengthening health systems? Because at the end of the day, all of this in silo, we've all learned that, right? I think that it doesn't really scale up. So how do you kind of look at system strengthening as an overarching piece? Yeah. So, like I said, I think for us, Ronika, data and evidence plays a very critical role, right, in driving both our own synthesis and analysis, as well as helping us shape, let's say, the work that we do with our clients and influence, the ecosystem thereof. So India Data Insights, which is what it's called, the IDI, is a platform which is an open source public good platform. Yeah. But the focus there is really using all of publicly available data across sectors, and the health sector particularly has several facets to it if you look at it. The focus is really to make this data consumable, interactive, understandable, and really helps you make decisions, right? So the level of analysis, it's not just data alone, right? So you have interactive discussions. So let's say you're looking at a region and you're trying to understand whether you want to invest in that region, you can actually slice and dice and look at the indicators, look at how deep you want to go, really understand what is, let's say, the geographical map in terms of relative need, right? So whether MMR is lower, IMR is lower, nutrition indicators are poor, it's NCPDs, whatever it is, right? And then help you kind of understand and say, okay, this is maybe what I want to focus on, for example, right? And there is also some level of analysis that is done in this regard, which again kind of goes to support this piece as well. So IDI, I think for us is a step in that direction. Right. And similarly, I think even across our research work as well, Ronika, a lot of this happens. So for us, I think data and evidence is sort of core to be able to kind of drive this. Yeah. So a couple of things I would say, Ronika, and I'm not going to really put it from a Sattva context, but more I would say from an ecosystem level, right? Which is that, see, there are, especially in health innovation today, in light of ABDM, the Ayushman Bharat digital mission, and on the backdrop of that, what we are seeing and we will see over, I would say, the next year or so is really plenty of emerging solutions, right? And what we've also seen, for example, is that there is an interest even from the philanthropy community to support this, right? Because COVID has sort of shown us how innovation and particularly technology innovation can, fast track in a non-linear way access to care, can bring in some consistency in terms of quality of delivery and so on. But I think the important thing to kind of take cognizance of is that the innovation by itself, may not succeed, right? And we've had experience of that as well in the past, where we've worked, let's say, on one problem, but realize that one problem is a part of a much larger whole. And unless the solution is able to address the larger piece or integrate with the larger set of solutions to be able to solve for the problem, then it won't move forward, right? And one example could be, for example, let's say you design a solution for ASHA workers, right? And have them, for them to kind of deliver better care, clinical decision support for them to be able to, do more stuff on field, task shifting and so on. But the solution itself was great in terms of it was designed with the users, it, understood their pain points, all of that stuff, right? But it's stuck right now because it's unable to integrate with the backend and with the larger systems, right? So I think there is a need to kind of, look at, even at the design stage itself, look at some of these innovations as a part of a larger whole. I think that's critical. Two is, the other thing that I've noticed at an ecosystem level, and this is from conversations that we've had with several leaders also, is that many times similar solutions or the same solution is supported by multiple folks to try out, right, as a pilot, which again, it just results in duplication of effort and capital, and it doesn't necessarily serve the purpose. So how do you also look at bringing in some of those efficiencies in the system itself, look at building on what people have done as opposed to, reinventing the wheel and so on, right? So I think that's the second part that I would talk about. And the third part, which is a critical piece in our minds for innovations to work in the system, is really the buy-in, Ronika, across the value chain of the system, right? Whether it's not just, let's say if you're working with the government, the health department, it's not just with the principal secretary health. The buy-in has to come in from the ASHA worker, right? So the design has to be kind of look at, the design of the solution has to really take a multi-user view as you bring that in, and the value for the user has to be very clear. Like the ASHA has to see value, the MO has to see value, and the PS has to see value for this to actually be implemented, right? So I think some of these pieces is what we are learning as well, both through our engagement and what we are seeing in the ecosystem and what we are also learning